Hi, I'm Dr. Patrick Foy, and I'm an MD or medical doctor, and I'm the founder and director of the Coccyx Pain Center or Tailbone Pain Center here in the United States, available online at www.tailbonedoctor.com. And the reason that I'm holding this cardboard box that arrived in the mail today is sort of an unboxing of sorts. Some of you may know that in addition to treating patients, I am a full-time faculty member here at Rutgers, New Jersey Medical School, where I'm a professor within the Department of Physical Medicine and Rehabilitation. And being a professor and academic faculty member, part of what that means is that in addition to being a physician and treating patients, that I'm also a medical educator, that I'm teaching medical students and resident physicians and fellows and colleagues, and also doing research and publications. And I probably have, easily over 100 publications between research articles and book chapters and various publications over the years, which is not surprising given that I've been in academic medicine for more than 21 years. But the part that's neat for me is that it's still exciting and I still love what I do. And I still love when I finally see something in print when I know that myself and my colleagues have been working on for a long time. So the unboxing of sorts, this arrived here at the Tailbone Pain Center here today. And in opening it up, it is basically the current edition of a journal called the Physical Medicine and Rehabilitation Clinics of North America. And they did an entire hardcover issue on pelvic pain specifically. And I was asked to write the section in here on coccyx pain or tailbone pain, since that's my primary area. So I can tell you that for myself and the other physicians across the country who have been involved in this particular publication, this has been at least well over 2 years in the making. Academic projects take a long time, but between the time you are invited to write an article or a paper or a manuscript or a book chapter and doing the edits and going back and forth with the editors and sometimes with medical illustrators and finally making it to publication and making it into print. It's always cool when it finally comes out and you actually have a tangible copy, and the idea that that tangible copy is also showing up in other places, that physicians are getting their hands on this and hopefully learning in this case, the proper way to evaluate and treat tailbone pain. Within this, if I open it up here, again, PM&R Clinics of North America, entire section on pelvic pain. There's lots of different authors from around the country doing their own different sections. There's a section here on anatomy and physiology, office evaluation of pelvic pain in general, myofascial pain, musculoskeletal pain, and then the next chapter, which is mine, which is basically on coccyx pain. So if I swing back to that, I'll share just a little bit with you of what's in here for physicians. Now, this is different than some of the things I've written and published more specifically for patients. I still continue to do that as well, and I'm a huge believer in empowering patients. But this particular, one is written for physicians. So if you have a physician who perhaps is a physical medicine and rehabilitation doc, this might be something that's on their shelf. If you have tailbone pain, you may want to ask them if they have received, the pelvic pain edition of the PM&R Clinics of North America journal, because there'll be lots of information in there, for them. And again, in this particular chapter on coccydynia or tailbone pain, we talk in here. I talk about the terminology, how frequent this is, the anatomy, the different joints, ligaments, muscles, etc. that attach to the tailbone, the different causes of tailbone pain. So here we're talking about coccyx fractures, dislocations, coccygeal dynamic instability, which means an unstable joint at the tailbone, which is one of the most common causes of tailbone pain and something that you really need sitting versus standing x-rays in order to evaluate for and make that diagnosis. We talk about, here I also talk about bone spurs at the lower tip of the tailbone, common source of tailbone pain, abnormal positions of the coccyx, arthritis, sympathetic nervous system pain at the tailbone, pelvic floor dysfunction, cancer, and bone infection, and lots of other things that can cause pain. This also educates doctors about the symptoms, pain with sitting being the most common, and many patients will also have pain with sit to stand. They may have other pain in other back, low back and pelvis and buttock regions as well. We talk about here, I mentioned about the physical exam findings to look for with tailbone pain. The diagnostic tests, so imaging studies like x-rays, and especially the sitting versus standing x-rays, explaining to them what that is, because unfortunately many doctors around the country and around the world are not familiar with sitting versus standing x-rays for tailbone pain, which is really unfortunate, because unstable joints are probably the most common cause of tailbone pain, and they can only be diagnosed on imaging studies by doing the sitting versus standing images. So those x-rays become really important. But I also talk about MRI and CT scan and nuclear medicine bone scans and other things. In the next section, which is on, well, actually within that area about diagnostic tests, I've also published, this is the first time I've published this particular algorithm, which is basically going from somebody that has pain and getting the x-rays, ideally the sitting versus standing x-rays, and then depending on what those show, deciding whether the person needs perhaps moving forward with treatment versus whether they may need further imaging studies such as MRI or CT scan or other things to look for malignancies and other conditions, depending on what your initial findings were on the initial studies, and then depending on how they respond to treatment, whether to circle back, and if you didn't get the advanced imaging studies like MRI or CT scan, to consider those in those patients if they're not getting the kind of initial relief or response. And then other things within treatment, everything from cushions to medications, to injectables, so some of the interventional injections that can be done for tailbone pain are covered in here, from steroid injections to ganglion impart sympathetic nerve blocks to nerve ablation, all of that, physical therapy, and in surgical cases, coccygectomy, which is surgical removal of the tailbone. Fortunately, not necessarily the majority of the time, and is sort of something that's done only when people have exhausted other measures. So again, a lot of information sort of packed in here for physicians, and hopefully the goal really is to educate physicians so that they can be as knowledgeable and experienced as possible in evaluating and treating patients with pelvic pain, and in my section for tailbone pain, coccyx pain in particular. So hopefully that will be helpful for the physicians, because then that will be helpful for their patients. Again, this one, a medical journal, mainly for physicians. I do also have written an entire book, much longer than what I have in here. It's an entire book about tailbone pain. This one is written more for patients or for people, non-physicians, the people who are actually suffering with tailbone pain. This one is 272 pages, all about the coccyx, covering in much more detail a lot of these things, and written in layperson language, so you don't need a medical degree by any means to read this book. You can find this on Amazon. If you can get it on ebook through Amazon. You can get the softcover copy through Amazon. At the time that I'm making this video, you can still get a free copy, just pay shipping and handling. You can get that through tailbonebook.com. So lots of different ways to get this if you have tailbone pain and are looking for more information and sort of to be empowered with with knowledge, because then that helps you with knowing what makes sense in terms of evaluation or treatment. So again, lots of information for physicians and also for patients. So hopefully spreading the word so that patients can get relief, because a lot of people unfortunately suffer unnecessarily for long periods of time with tailbone pain, because not a lot of docs are familiar with how to treat it. If you're looking for more information, certainly you can find me online at www.tailbonedoctor.com. And if you have questions or comments, certainly post them down below beneath the video, and I'll look forward to hearing from you and maybe meeting you some of you someday. So all the best. Bye bye now.